When it comes to the issues that I deal with on a daily basis, they are embarrassing situations, they're embarrassing conditions, they're embarrassing diseases that unfortunately people don't want to talk about. But it's incredibly common. So if you're 50 years old and you walk into a room with women your own age, out of those 10 women in the room, 4 of them are going to have an overactive bladder. Similarly, 3 are going to have stress urinary incontinence, the laughing, coughing, and sneezing. That overactive bladder is only going to increase with age. And by the age of 70 to 80, you're looking at 60 to 70% of women having this disease. And it is a disease. It is something that we can treat and is something that we have excellent therapies for that we deal with on a daily basis. The American Urologic Association has created a care pathway. It consists of first, second, and third line therapies. Third line therapies are the most advanced. They involve things like percutaneous tibial nerve stimulation, which is really a fancy acupuncture that stimulates a nerve that runs up your leg. Done in the office, no sedation, there really is no risk associated with it. There's also something called sacral neuromodulation, which is also known as Interstim under the trademark of Medtronic. And what that is a little pacemaker for the bladder. It has a small lead that goes in and stimulates this nerve that's spasming, causing the bladder to spasm. Light sedation in the operating room. The other option is something called Botox. Just like Botox relaxes all those Hollywood stars' faces, it relaxes the bladder and is something that's done in the office under just topical anesthetic or light sedation in the operating room. Now, most patients do not need to go on to these advanced therapies. 70% of them are treated with first and second line therapies. Second line therapies are medications, easy to take, 1 to 2 pills a day. The majority of them don't interact with any of the other medications that you're taking. First line therapies are things like watching what you drink, when you drink, how you drink, as well as pelvic floor physical therapy, which have no risks associated with it. One of the things that I'm most commonly asked is whether laughing, coughing, sneezing, and leaking urine is something that is a normal part of aging. I had my children, it's something to expect. The short answer is absolutely not. It is not to be expected. It's a disease. We call it stress urinary incontinence. And when it comes to stress urinary incontinence, it's also extremely common. So about 30% of women between age 30 and 40 have this disease. And it's something that we can treat, and it doesn't have to be surgery. So some of the most minimally invasive options include physical therapy, strengthening that pelvic floor to allow what we call a guarding reflex. So when you laugh and you cough, you can actually hold on. You can get on that trampoline. Other therapies include things like a pessary, which is a small vaginal insert that creates a little speed bump underneath that urethra. So when you laugh and you cough, that urethra can kink and can prevent that leaking. Now, there are surgical options which are very, very effective in the 80 to 90% effective range for your lifetime. And what these do is, again, recreate that support of that urethra so that it kinks when you laugh and cough and sneeze. But these are all options that we can talk about when you come in and visit because these are all individualized and something is going to work.